Ralph is at it again on social media. If you know who Ralph is, you know he's an activist, always calling out politicians, especially videoing them, putting them on camera. And on social media, it looks like he has replicated that again with Ridge Hospital this time. And in the video, you would see that he was complaining of bleeding and there is no one there to attend to him. And it has got some mixed reactions on social media. Others believe that he is flouting the hospital's regulation, so he should be arrested. Others also believe that no, he is calling out the ills and inefficiencies of the hospital. And I ask the question, in any case, should the hospital be focusing on Ralph's action or focusing on fixing the inefficiencies in the hospital?
So, first and foremost, let's condemn what Ralph did. It shouldn't be countenanced at all in any sphere of our life. See, you can't use chaos as a means of solution when it comes to dealing with something as sensitive as patients' confidentiality and people in a health care or health hospital or facility. No, you can't do that. First and foremost, people are going there and they are already in their vulnerable state. You can't go and do videoing people who don't even want the world to see what they are battling with and all of that. There's a reason why there's patient confidentiality. You will go to a hospital, you will see that visibly you are very frustrated about a process, how you think the health officials should have done some things and they are not doing. That is why they have a complaint desk. They have suggestion box all over the place. Use the right channels. Let's not encourage this rowdiness of pulling out your phone and threatening everyone.
Have you seen or have you experienced the service delivery in our hospitals? Because I have, and I can tell you this, it is not encouraging at all. Yes, you can say, yes, the people who work in there have laid down procedures and all of that. But bro, if you are at a hospital, look, I was when I fell ill and I was on my hospital bed. One day at dawn, a patient came in and the person who brought the patient in said that the patient was unconscious, so he needed help to bring the patient in. And the doctor was like, no, I mean, I cannot come out there to look at this patient. And I was worried because this is a patient who is unconscious. So you would think that there will be some level of urgency that the doctor would have attached to that when the person came with that complaint. But I didn't see anything like that. And bro, if you go there and you start your check-ins from 8 a.m., by the time you are done, you can be living there around, if you are not lucky, evening. And this, you see, look, we've always said that we are building a nation. And we've agreed that to build a nation, we need strong institutions. So I am asking, is it wrong that Ralph is throwing light on inefficiencies in the hospital, like service delivery being poor and being bad? What is wrong with that for an activist who wants to see strong institutions work? An activist who wants to see institutions that will help build a nation work. What is wrong with him throwing light on that? And rather, we should rather criminalize his action. What is really wrong with that?
To start with, Dennis, we are not in an animal kingdom. No. We are not in an animal kingdom. If we want to use this route, what will happen is that you mentioned that you were on your sick bed. Some sickness would require that you are butt naked on your hospital bed. And all you know is that for whatever reason, someone will just put you on Facebook Live and the whole world will see that your sickness requires that you be butt naked and sleeping on your hospital bed. What I am saying is that I am an approach person. If you think someone is wrong, use the right approach. What we will encourage with this rowdy attitude of Ralph is that it will encourage people to go into hospitals and enforce. So it's just like someone stealing and you think you can be a police. Yes, when you arrest the person, what do? Do you lynch the person? Do we allow mob to just attack the person? No. You follow due procedure by taking the person to, say, a police station. Let the law work. If you put laws in your own hands we are not saying don't expose rots or expose inertia, and you feel like you've gone to an hospital. The nurses are not empathetic. They are just not concerned about the situation.
You know, sometimes it's how you serve. Even how you serve the patient is a healing in itself. But you go, the attitude is not encouraging, bro.
It is natural for human beings to highlight the negatives more than the positives. We always talk about nurses and their conditions of service and how they are trying their possible best to deliver health care in this country. We are rather shooting the messenger and not the message. The real problem is that, are they even equipped? Some cases, genuinely, I'm not sitting here to belittle anything. Genuinely, some cases are supposed to start from, say, polyclinic. Sometimes CHIPS compound, polyclinic, it has to graduate to get to a tertiary facility. But we live in a country where somebody is coughing, they are going to Rage. Somebody is coughing, they are going to Kolebu. There's pressure on the system. And this is an emergency service they are providing. It is natural that when you have an emergency case and you go to a hospital, you want to be prioritized. Hello, you coming in right now doesn't mean that they should leave everybody to come and attend to you. That won't happen.
Granted, yes. Kingsley, granted. But what I am saying goes to the heart of ethics. Do you understand? We have hospitals in this country where you enter and there is no sense of urgency amongst these people. Now, if you look at and if you compare these, we are talking about they not being equipped and all of that. At the end of the day, let's take the fact that okay, you've not been equipped, but at the end of the day, how do you even serve? How do you deliver your duty as a professional? All of these things are matters of concern because I know as a doctor, you take an oath. So irrespective of whether the working condition is bad, is not good, is not up to your standard, once you have taken that oath, you swore an oath to save lives no matter what, no matter where. So that oath should be respected.
There are bad people everywhere, including the nursing and the health facility industry or sector. There are bad people everywhere. Let me ask you a question. When was the last time you wrote a petition, you wrote a complaint to a health facility you visited because a nurse treated you poorly?
No, I don't recall.
These are all hearsays. People are there. There are committees. There are disciplinary committees. There are bodies like the Pharmaceutical and Dental Council. There are nurses and midwifery council. They are there for us to complain to them. Be specific. Let them know that I went to this hospital. Nurse ABC, doctor, because you always have their names.
Yeah.
So
there.
we should follow the process. Unless we are saying we should throw the laws away and do whatever we like.
No,
that will be chaotic. So if we continue like this is an emergency situation. You went to an emergency ward, whether or not people panicked. People panic. That is my problem. You go to hospital thinking that you are going to get health care. All you are met with is someone videoing you, threatening people around. And what breaks my heart is that there were police people standing there unconcerned.
No, but I understand he came to calm the situation down and restore order.
But it is not in the place of Ralph to threaten health personnel. No, it shouldn't be encouraged. Like I keep telling you, at least I'm privileged to have someone who works in the health sector in my family. And the things I am privy to, I can't share them, but all I'm saying is that some of the nurses may be bad. Others are trying their possible best. You went to an emergency ward. At least with the videos I saw, I didn't see anybody sleeping. I didn't see
But,
any
but
doctor or
you
nurse
don't have
sleeping.
to see them sleeping to know before you can know or tell that they are being lackadaisical at their job. They are being nonchalant.
That's what you think. But I'm just saying that it won't be fair to box all of them into that statement to say they are being lackadaisical, they are not doing their jobs. If they have the means to do their job and they are there, they can do it. What I am saying is that when you walk into a hospital with an emergency, our assumption and our expectation is that the nurses and the doctors will leave everybody else to come and attend to our patients. And I'm saying that it doesn't work like that all the time. As you are saying, someone might be unconscious, but somebody is in consciousness, and maybe in the next 5 minutes, if nothing is done, the person can die.
Well, from your submission, clearly we can tell that yes, there are ills in our institution, especially
address the root cause,
the health sector.
Yes.
So then, I am of the firm belief that the responsibility shouldn't just lie on the doorstep of Ralph alone, but the hospital should also take some level of responsibility, because I don't think Ralph is a man of insanity that will just go take out his phone and then start recording and calling out people. If truly doctors were available at the time and attending to emergencies, then if he had done that, then we can call his insanity out.
But that's not the best approach.
That can be a different conversation.
Because he was actually inconveniencing a lot of patients.
But my point is, what responsibility is the hospital taking in all of this? Because other than let's criminalize Ralph's action, other than that, what really are the hospital doing? Because that man didn't do that out of vacuum. Because there was a problem and he sought to call them out. So the hospital, if really they are a forward-thinking hospital, what are they really doing?
Of course, they will launch their internal investigations and ask what happened. Maybe if Ralph has taken his time small, he could have even asked, who is the medical superintendent? Who can I talk to? Because this is the problem. But you don't just pick up your phone. What is this trend of picking up your phone to threaten people? Like, imagine one of the patients, they had his or her mother or grandfather, I don't know the gender, but it's like the older person was on her lap, and I'm like, this is not good.
Yeah,
this is not good. Let's follow due procedure. What I am afraid of is that I know my people, it will become a trend. It is going to become a trend, though.
No,
someone is going to take their HIV drug. You see yourself on Snapchat, on TikTok. That's what is going to happen. So you see, these people are lined up. They are going to take their drug. Government hasn't brought the drugs. Look at them. They are sitting down.
Kingsley,
that is not the way to go.
You see, Kingsley,
report
sometimes
them and let's discipline them.
Kingsley, sometimes you want to use the right procedures, but often than not, the right procedures don't get you the answers you're looking for.
First.
You see,
exhaust that first.
Well,
we are teaching the next generation.
Yes.
Let's not put iota of.
Sometimes what gets you the results are unorthodox. You get it, but in the end, you want to get the results. See, this institution. Look, I had a personal experience when I was when I was trying to get my driver's license. I did my eye test.
Okay.
I had to redo it again, and this time they weren't willing to they wanted me to pay for the second time.
Okay.
I said what I could, but they wouldn't budge. Do you know what made them change their position? When I took my phone out and started recording the institution's name and telling them how they are trying to dupe me, that was when they quickly changed their stance.
Maybe you will land a slap. Don't be doing that. That's what I'm trying to tell them. What Ralph has done and gotten away with, why they like us to throw me a bench? Don't do that.
You know what?
And in all of this too, our Minister of Health, that thing now they just good and what's happening, they have entourage. Massa, you know the problem.
I like that stuff.
We are not in SHS. Do what you have to do. Make sure you don't have to be there for things to work smoothly. As a minister, I agree, you have to be hands-on, be there, but do your part. If they need the hospital things, the beds, We agenda 111 is in the bush. We don't care who started it. Let's get health facilities closer to people so they don't go to a place like Rich plenty with minor things we could have done in our neighborhoods or districts. Let's keep doing that, because if that doesn't happen, you have a lot of people in the emergency setting that will not get health care that they need.
I agree with you to a very large extent, because I mean, on one hand, if we are calling out people to be professionals and be up to task, I think it is only fair that we provide them with all the things that would need them to be up to that task. So, of course, we are all involved.
Yes.
Like we always say, we are
But the
all
nurses, their lives matter. No nurse should feel unsafe or threatened at his or her own workplace. The bad nurses too, you should repent.
Yes.
For the end is near.
I agree. Preach on.
But please, videoing people, especially I've been to female ward before to even go and visit my sister once, and you have women naked, literally. They don't care, because where they are at that point in time, it's not nakedness that's going to stop them. But there's a reason why they trust that people can come around and we won't even video or let the world know that this is what they are going through. So if you are in a hospital setting, it is private for people. Don't anyone acquire Snapchat. Don't go and do Facebook Live, for you can be sued. Now the way to the court is very short. The law is the law. Follow the law. If you follow Ralph, you might end up in jail. Well, we don't know what will happen, but this is just an eye-opener. It can come up with or it can become a recipe for a lot of things that will follow later. Ralph, you'll be in jail.